Call to order the Health Committee. Want to thank everybody for being here, and good morning to the members of the committee, the guests, and folks who are here. We have 4 bills today, and to consider. One is for discussion only. The first thing I want to do is thank our pages who are here. Cameron Howell, who is Representative White. Stand up, wave. Awesome. Haley Moon, Representative Donna White, got the double duty today. And then Alexandria Parker Horton, Representative Price in the back.
She's right here.
Oh, she moved. You moved on me. There she is. All right. Hopefully you're going to learn a little bit this week. Also want to thank our Sergeant at Arms, Terry McCraw, Nina Lage, and Russell Salisbury in the back. So thank you very much for being here today. The first item on our agenda is the Respiratory Care Modernization Act, House Bill 71, and I'm going to call up Representative Moss for a presentation.
Thank you, Mr. Chairman, members of the committee. I believe there's an amendment, if we could take that up.
Yes, go ahead.
Okay, Representative Clampett.
Yep, there you are. Representative Clampett, recognized for his amendment.
Yes, sir. Thank you, Mr. Chair. I move to amend the bill on page 2, lines 34 to 38. I can read that if you like.
I don't think you need to read it. I think we can all do that.
Okay, great. It's on dashboard. I make a motion that we approve the amendment.
Okay. We have an amendment on the floor. Is there any discussion about the amendment? All right. Seeing none, all in favor of the amendment, say aye. Aye. All opposed, say no. The ayes have it. The ayes do have it. We are now considering the bill as amended. Representative Moss.
Thank you, Mr. Chairman. House Bill 71 before you, for your consideration, would pretty much create an advanced respiratory care practitioner position. Clearly in the bill's outline what they could do, can't do, the requirements. There's a lot more educational requirements, a lot more time in the field actually just getting more educated on everything that they need to do with this position that could be created. Right now, there are none that I know of in North Carolina. We do have some college universities that are interested in this program. This could fill some holes and gaps in our needs in this state for some medical care. As we all know, the Center of Disease and Control identifies 3 of the top 5 leading causes of death as diseases of the cardiopulmonary system. And this really could help us out with the shortfalls that we're expected to have with cardiologists and pulmonologists in the future. But this would create a position, but it would work under the direction of a physician. And I would appreciate if you'd consider the bill.
Representative Clampett, you're recognized.
Motion at the appropriate time, sir.
Got it. Yes. Representative White, go ahead.
I have a question for the bill sponsor.
Go ahead.
Representative Moss, thank you for being with us today. I do have a couple of questions that are concerning me as a registered nurse and as a healthcare provider. When this bill seems to be an incomplete bill, and so I need you to help me understand how it's complete. There are already respiratory therapists. Nurses also provide respiratory therapy. But this bill says that in the whereas statement, it says that the North Carolina General Assembly governing the profession of respiratory care reflect current practices, improvements, and other developments that have occurred in the profession. But then it says, whereas the current statutory language does not fully encompass current practices, improvements, and other developments. And I could not find any current practices, improvements, and other developments referenced in the bill. And then when it talks about the advanced practice respiratory care practitioner position that doesn't exist yet, it says that whenever they perform their function, there has to be a physician in attendance. Now that's what the bill implies. That may not be what you mean, but that's what it implies. You know, I've been battling now for 8 years to get the Nurse Practice Act passed so that nurses with bachelor's degrees, master's degrees, doctorates, degrees of doctorates cannot practice in North Carolina without signatures twice a year by a medical, medical practitioner, a doctor. And so I'm really struggling, and I struggled with the same thing last year, so I'm sure you knew I was going to say something today. But I am really struggling with a new position that is being formed that has absolutely nothing in this bill to tell me what they're going to do. But it does say that whenever they do anything, they have to be under a physician, which I think is a great thing in this situation, because they obviously, there's not any intent here to, there's no reference here for me to know what they're going to actually be doing other than what respiratory therapists already do. And when they are already somebody out there doing this, I don't know why we're doing this advanced practice respiratory therapist with an incomplete bill. And I'm not trying to be ugly. I'm just trying to protect the public, and I'm just trying to compare that with what other groups are already doing and are educated to do and are not allowed to do without, oversight from, not oversight, but just a signature. So I guess that would be my first question. My second question would be, are we going to put them under the same practice as advanced practice registered nurses? And if that would be so, then I think we need to have consultation with the Medical Society, because I think they would have a lot to say about that.
Representative Moss.
Thank you, Representative White. And as you know, I'm not very familiar with a lot of the health bills that come through, but this is a need in the areas that I'm aware of. And it does have some outlines in the bill, maybe not clear and distinct as needed at this point, but it's basically up to the discretion of the physician and how much or what range that they can work, from my limited knowledge. I do understand respiratory therapists and nurses and doctors and all in between. And I do understand your frustration about the work you've done the last 8 years. But this bill is something that we ran last year. It passed. It has a companion bill on the Senate side that's being ran. And to be honest with you, I could probably have someone here in the audience answer your questions a little better than I can, because I am neither a respiratory therapist or a doctor or anything in the medical field. I change oil and tires.
Representative Campbell, you're recognized.
My question is kind of along the lines of Chairwoman White as well. I'm a little bit concerned about the vagueness of this bill, and I've had conversations about this with stakeholders. And despite there not being clearly delineated privileges in the bill, some of the things that have been mentioned in conversations when they've met with me are procedures like bronchoscopies that they could do without a physician in the room. My concern with that is, one, there's no one in the room that can handle the complications of bronchoscopy. Two, as the bill says, this would exclude diagnostic procedures, and bronchoscopy is clearly a diagnostic procedure. How do you know where to focus on and things like that? I have, and if you have clarification for this, I'd appreciate it, but I'm very concerned about the lack of specificity about what is allowed and what's not allowed for them to do without a physician in the room.
Representative Moss.
Thank you, Representative Campbell. Like I said, I have someone in the audience who can speak into more detail about this bill. It's been out there for a while now. I hate we couldn't work with everybody, but I know it's been amended and changed several times. We have dealt with many organizations to make sure that it would not offend anybody in particular areas of the medical field, and just trying to better a situation that's bad. But I understand we don't want to rush to that, but I could defer some questions to Dr. Croft if that's appropriate time.
We can also defer to staff. I think if you can weigh in on that, please.
Jason Moran Bates, Legislative Analysis. A little bit of a question about the bronchoscopy and being a diagnostic procedure. The bill does say the practice of advanced respiratory therapy does not include certain things. One of these are ordering or performing diagnostic and therapeutic procedures that are more than minimally invasive and have known complications. The amendment that just passed actually specifies that a physician has to be supervising when those procedures are done.
Representative Cunningham, you're recognized.
Thank you, Mr. Chair. It's a couple of things. I do have one question because I'm kind of confused about the advanced practice program, us setting one up. I support us setting an advanced practice program up, but I got a question. do the respiratory therapists in North Carolina already have a compact?
Representative Moss or staff?
I don't know about a compact, but I do know that Article 38 has some dealings with respiratory care, but to answer your question, I don't have an answer for you, Representative.
Staff?
Jason Moran Bates, Legislative Analysis. The respiratory therapists do not have an interstate compact in North Carolina.
Okay, follow up, Mr. Chair. I have some of the same concerns as Representative White and Representative Campbell. I understand the supervision of a physician for invasive procedures. I understand that, but I think the bill needs to be displaced, and it's some more work that need to be done on it to sort of get more meat inside of the bill. I don't have a problem with the advanced program being set up. Would love to see it happen, but I think some more things need to be inside of the bill before we move it forward. Thank you, Mr. Chair.
Okay. Representative Lambeth, you're recognized.
I know that committees are different and they change from one session to the next, but this basically is the same bill we passed 117 to nothing last session. It wasn't 117? We had one, excuse me, we had one correction, we had one no vote on that vote. I do remember you voting no. It was pretty close to unanimous, let's say that. But it's the same bill we passed out of the House. Didn't get anywhere in the Senate, so I thought that might be important.
Representative Cervantes.
Thank you, Chair. So I have a lot of agreements with my colleagues, but I do want to ask some particular questions. I do recognize that we had voted on in a majority, it did pass in the House. But as we are here as scientists and health people on this board, scientific method and iterative knowledge helps us make better laws and better science. So I do want to ask, as I always do, did you work with the Medical Society, not only on the amendment, but the base bill, in trying to see if there's an update towards last time, because it didn't pass last time, if it could be made better?
Representative Moss.
Thank you, Representative, for the question. Work with many different entities, and so many I can't remember, because dealing with a health bill, everybody has requests. Of course, we did get it past the House last time, but the Senate chose not to take it up. This time, the Senate's running a companion bill, same as before you today. So either or, you'll hear mine, maybe theirs will come over, but I have worked with anybody who is willing to reach out to me, and we have made concession and change multiple times. And I just hate that more people didn't reach out to me before today. Maybe the bill didn't get to you till this morning, but to answer your question, I've worked with any and each person who wanted to work on the bill.
Representative.
That's
Representative Bell. Oh, Bell, did you both have hands up? Okay, Representative Ball, I'm sorry.
Thank you, Mr. Chair. Just a clarification, was there a different bill than House 316 last time that we're to look at to compare the votes? Because 316, I think, is the bill last time, most similar to this one, and the votes were 87 to 29. It passed, but is there another bill that I'm not citing from last session? Okay, thank you.
I just got bad information from one of my chairs here on the right side of me.
That's as you face us, not as we see it.
All right. We did have, any other members of the committee, we did have one person sign up to speak, and if he will come forward and identify himself, and you will have 2 minutes to speak.
Thank you, Representative Reeder and Mr. Chairman. My name is Bill Croft. I'm the Executive Director of the North Carolina Respiratory Care Board. The Advanced Practice Respiratory Therapist is a mid-level practitioner that is similar to the nurse practitioner or the PA. They go through the same courses as the nurse practitioner does. The program is going to be held at UNC Charlotte with an interest by Campbell if this actual licensing bill passes. During the negotiations of House Bill 316, which this bill, with the exception of the amendment you just made, is exactly the same, we met with the Medical Society, Medical Board, Anesthesiology Association, and Dr. Reeder was so helpful in the language that you see before you. We made sure that everyone was happy to move forward, and that's the reason it passed in House Bill 316. The amount of detail that we seek in any bill sometimes you can really get into the weeds. So we had to come up with a way to actually get to the heart of it. And that last amendment you just made basically refers to the scope of practice for respiratory care, which is already in our current bill. So I'd have to have the amendment up in front of me to actually tell you exactly where, but towards the last line, we have a reference to the scope of practice for respiratory therapy. So what will these individuals be doing? They will be assisting the 400 pulmonologists throughout the state having to deal with people with diagnosis of COPD and asthma. There are over 2 million at this point in North Carolina. So imagine 400 pulmonologists for that number of people with lung disease, and that's not even counting other lung diseases. This individual will be the heart and the thrust of it will be care planning and ordering, like in a facility, changes in therapy. Again, going back to the scope of practice. With procedures such as bronchoscopy, and I spoke with Dr. Campbell on this several times, and we have a 4-member board, four physicians on our board who will be adopting rules, and we all agreed that diagnostic bronchoscopy would not be something that would be part of the scope. They would be assisting the physician.
Please wrap up.
With that.
Please wrap up.
Okay. I will be glad to take any questions.
Representative Cunningham, you're recognized.
Thank you, Mr. Chair. I wanted to ask if we can just move it to the side for right now and give everybody an opportunity. I appreciate the speaker diving in with the additional information that did help me some, so I'm not asking for it to be displaced, but just can we hold off for a few on it for right now until everyone has the opportunity to review what we did before and what is precisely inside of it, even if it is the same. We've been here all last year, so we don't remember every bill. We don't remember everything that passed, but we would like the opportunity to go back and look at it. Thank you, Mr. Chair.
So, Representative Moss, this does have another stop, Representative Cunningham, before it goes forward. Would you like to proceed today?
Mr. Chairman, let's vote it up or down. Everybody's had this bill for an extended period.
Mr. Reader, I have a question.
Representative White.
My question is for our speaker, our presenter back to back. Since this bill does not address the specific things that an advanced practice respiratory therapist would do, could you share with us the difference between what is currently being done by a respiratory therapist and what would be done? Because it is not in this bill. So we're basically voting for something that we don't know what's in the bill. And I think that's one of the biggest issues right now. But if you want to share that with us, that might bring some light to the situation.
We're not gonna hear from you, Representative Blackwell.
I had a question for staff, if I may.
You're recognized.
With reference to the questions that have been raised regarding scope of practice and sort of defining more specifically what an advanced respiratory practitioner would do, in connection with advanced practice nursing, CRNAs and others, do we typically have more in the statute on those matters, or do we leave that to a licensing board to come up with that aspect?
Staff.
Jason Moran Bates, Legislative Analysis. In this bill, the practice of advanced practice respiratory therapy is defined on page 2, lines 28 to 40. The really meat of that definition is the scope of practice as determined by the supervising physician at the practice level in any healthcare setting authorized by the supervising physician in the board. So that would be the scope of practice for these advanced practice respiratory care individuals. And then 7 things are specifically excluded from that. So they could not be in the scope of practice. That's medical diagnosis, prescribing, interpretation of diagnostic imaging studies, final interpretation of sleep studies or pulmonary function tests, surgery, delivery of anesthesia, and then the piece that we discussed a little bit earlier, ordering and performing of diagnostic and therapeutic procedures that are more than minimally invasive and have known complications unless a physician is physically present to supervise those procedures.
Follow up, please.
Briefly, we have 4 bills this morning, so.
Just, it seems to me that what you read is simply saying we're leaving the scope of practice to be determined in each individual case by a supervising physician and by the board that is, of course, not present there. Is that the way we have handled the others, by basically saying it's determined by a physician case by case or by the board rather than us having something statutorily in there?
Staff?
Jason Moran Bates, legislative analysis. It's really hard to say, Representative Blackwell. I can give you the definition of practice of nursing as a registered nurse in Chapter 90 if you'd like that. It lists 10 specific items, and I can read those out for you if you'd like, just to give you an idea of the differences.
All right. Seeing no other comments, Kyle Hall.
Motion at the appropriate time.
I think Representative Clampett had asked that before, so I'll defer to Representative Clampett for your motion.
I move that House Bill 71 as amended be rolled into new committee substitute, and the new committee substitute be given a favorable report, unfavorable to the original bill.
With a referral to regulatory reform?
Whatever it goes.
Yes. All right. So you've heard the motion. All in favor say aye. Aye. Opposed?
No.
The ayes have it. The ayes do have it. That will be rolled into new PCS. It's already been voted on. That's not in order. We've already given the results. Next bill on the agenda is going to be House Bill 99. And I think this is for discussion only. This is the Reflexology Right to Work Act. We are a little bit pressed for time, so we'll go ahead and hear this and for discussion only.
Thank the chair. Here with my primary sponsors, Mary Belk, Harry Warren, and Mark Brody, who sends his regrets. He's off plotting something about housing, I think, somewhere. What you have before you, friends, is the Reflexologist Right to Work Act. If it looks familiar, it's because this passed unanimously on the floor of the House last session. And what this bill would do, very quickly, it would exempt nationally certified reflexologists and reflexology students in pursuit of a national certification from oversight from the North Carolina Board of Massage and Bodywork Therapy. I would add that the North Carolina Massage Therapy Association has no problem with this bill. In the past, it has been difficulties with the Massage and Bodywork Board, but not the regular practitioners. What would happen, this bill is creating a safe place in which reflexologists who are nationally certified can operate here in the state of North Carolina. If they have a current certification from the American Reflexology Certification Board, that is basically their license to practice here in North Carolina. Then it also provides a means for someone who is a student to earn, without being harassed, to earn a national certification. That's pretty much what the bill does. This is not to be confused with massage. Reflexology is quite different from massage board. And I think here in our state currently we have 50 people who are nationally certified that are operating and seeking just simply a safe space in which to act. I stand for any questions, Mr. Speaker.
Thank you, Representative Riddell. Any questions from the committee? Representative Potts?
Thank you, Mr. Chair. Representative Rydell, I have a question for you over here. Are there any colleges or schools in North Carolina that offer the certification for reflexology?
I'm not 100% certain, but I know we have our national chair from the North Carolina Association that could answer that question.
And I follow up, Mr. Chair.
Go ahead.
How do you get certified? If there's no schools to approve your work or disapprove your application, how do you go about getting certified? Thank you, Mr. Chair.
Certification through the, I'm sorry.
Yep, Representative Rydell.
Thank you, Chair. Certification through the national board requires, I believe, 110 hours of instruction and demonstration. And again, we do have an individual here with us today who could answer that much more knowledgeably than I do.
If there's no other questions from the committee, we didn't have anybody signed up for public comment.
So I thought there was.
Sergeant, do we have somebody? I don't have anybody on my list to speak. But if we have someone who would like to speak for a minute, we can do that. Just please identify yourself and who you're speaking for.
My name is Cynthia Hill. I am a nationally certified instructor of reflexology as well as a nationally board certified reflexologist. People come to me for education in reflexology. I teach a minimum of 300 hours. The ARCB has recently upped their requirements to 200 hours. This is a brand new thing. And education through my school would put an individual in position to be able to sit for their national boards. I am proud to say that my students have done exceptionally well, and because we have a state, and I take our motto to heart, to be rather than to seem, very seriously. You have among you in your state the most highly educated reflexologist in the nation. The advantage of being a board certified reflexologist dates back to the fact that we have never had an individual that has ever been so much charged with jaywalking. These are people of the highest integrity and ethics. Thank you for your time.
All right, thank you very much. Seeing no other recommendations from or questions from the committee. All right. All right. Well, are you wishing to speak on the bill? Okay, you can have a minute. Just identify yourself, please.
Yes, good morning. My name is Blair Nelson. I'm here from the North Carolina Board of Massage and Bodywork Therapy and would just like to voice the board's opposition to this bill. The board currently licenses reflexologists as massage and bodywork therapists. So therefore the board has jurisdiction over bodywork therapy, which is what reflexology is. The board is of the opinion that reflexology is bodywork therapy. This bill does not provide for any oversight of reflexologists. Additionally, during its investigations, the board has determined that reflexology is being advertised and practiced by unlicensed individuals. This will create confusion for the public and law enforcement because they can disguise their operations. The board is concerned about another board's ability to adequately regulate reflexologists, particularly those illicit, illegal massage businesses that are fronts and using reflexology to further human sex and labor trafficking.
Please summarize.
In Carolina.
Thank you very much. All right, thank you very much, committee, and Representative Rydell.
Concluding remarks.
Yes, go ahead.
Folks, nobody ever has been accused of any crime who is a nationally certified reflexologist in North Carolina. It has never happened. What they're doing is conflating people who put up a sign that says reflexologist and then operate an illicit studio or something. Well, I can put up a sign that says I'm a brain surgeon. It doesn't make me one. All right? But I would just urge caution when you're hearing that kind of criticism, because not one person who is a nationally certified practicing reflexology in North Carolina has ever been arrested for any kind of crime related to trafficking, and that's the inference made by the board. I would remind you that the Massage Association has no problem with this bill. Those are the folks who are out there doing the daily work of the massage therapy world, not people sitting in a boardroom. Thank you.
Thank you. All right, next up on the agenda is going to be House Bill 242, adding psychiatric hospitals to Medicaid HASP. Representative Lambeth, I think you're going to present this.
Thank you, Mr. Chairman. Hopefully this will be fairly quick because you're familiar with the session that we passed a HASP for acute care hospitals, but we did not include the psychiatric or mental health hospitals. So they approached me about including them. There's no cost to the state. This would simply add, it would require federal approval. And certainly with the uncertainties in Washington, we're not sure how that might go, but we do think it's worth seeking federal approval and including the psychiatric hospitals in the Medicaid HASP. If you remember how that works, they put up the funds, then there's a matching component, it comes back and it's distributed. We know that our psychiatric hospitals are financially challenged and stressed, and we do endorse this as a good way to help them with some of their challenges, trying to meet the demands for the patient load that they have. So that's essentially what this does. There is a group looking at some of the provisions in here to make sure it is as strong as we can make it when he sent it to the federal folks for approval. It does have a referral to finance, and if there are changes, we may have to make those in finance, but they're working on it even as we speak. I would like to keep this bill moving because I'd like to get this out of the House and Senate. The Senate's inclined to also take this up so we can get the request to Washington as soon as possible.
Representative Cunningham?
A motion at the appropriate time.
All right. Representative Loftus?
Thank you, Mr. Chairman. Representative Lambeth, are you saying that the mental health hospitals will pay that 10% just like regular hospitals, but hospitals won't lose any money by adding them on, correct?
That's correct.
Thank you, Mr. Chairman.
Seeing no other questions from the committee, Representative Cunningham, you're recognized for a motion.
I ask for a favorable report to House Bill 242, refer to finance, and favorable refer to rules. Thank you.
You have a motion on the floor for favorable referral. All in favor say aye. All opposed say no. The ayes have it. The ayes do have it, and it is moved on for referral.
Thank you very much.
And at this time, I'm going to step off the dais and turn it over to my esteemed senior leader, Representative Potts.
Thank you, Dr. Reeder. You're recognized to discuss House Bill 231.
All right, and Representative Potts, there's an amendment that I'd like to take up first, if we could.
Is someone else going to run the amendment? Or are you going to run it?
I was going to run it, if that's okay.
Everybody has a copy. It's on the dashboard or at your place. Any discussion on the amendment? If not, is there a motion to approve? Representative Kaufman.
Thank you, Mr. Chairman. A motion for adoption of this amendment.
Okay, all in favor of the motion as presented, aye. Aye. Any opposed? The motion's passed. We're back to the bill as amended.
Representative Potts, thank you very much, members of the committee. This is another one of the compact bills. We did the medical compact a few weeks ago. This is the social work. We might have another compact coming up for another discipline. This started off as a project of the Defense Department and the Council of State Governments to make licensure across state lines easier. This bill is similar to other 6 licensing boards that have compacts: audiology, speech-language pathology, counseling, nursing, occupational therapy, psychology, and physical therapy. So those are already in existence. The difference between this one that we might have heard a few years ago, the compact is currently operating. There's 22 states that are member states of the compact currently. This does not take away the ability of North Carolina to regulate the practice. This just simply allows us to have a consolidated way for licensed social workers to get an easier license between different states. I'm happy to answer any questions or go into details, but would ask for your favorable support.
Okay, any questions? Representative, you're for a motion at the appropriate time.
Yes, sir. I ask for a favorable report to House Bill 231. If favorable, refer to Finance. If favorable, refer to Rules. Thank you, Mr. Chair.
All right, let's put that on hold a moment. I believe we have 2 people signed up to speak.
As amended, I'm sorry.
Valerie Ardent.
Thank you, Mr. Chair, and thank you, committee. My name is Valerie Arndt. Aren't you glad to be in House Health today? I'm the Executive Director of the National Association of Social Workers North Carolina chapter, and I thank you all so much for taking up House Bill 231, the Social Work Interstate Licensure Compact. Social workers are the largest provider of behavioral health services in North Carolina and across the nation. However, North Carolina is contending with a shortage of mental health providers, and an interstate compact will allow for practice mobility and remove barriers from preventing social workers from providing continuity of care. The compact will ensure the licensees abide by regulations and rules that govern the practice of social work in North Carolina. The compact will modernize data sharing between states, which optimizes public protections for vulnerable clients. In 2021, the Department of Defense, as part of an initiative to promote license portability for military spouses, funded an initiative to establish this legislation for multi-state social work licensing. The compact will make it easier for North Carolinians to receive mental health support they need during times of disaster. The mental health needs of those impacted by Hurricane Helene are significant and will be there for the long term. Our social work members in Western Carolina had clients evacuate to Tennessee, Virginia, and Georgia and other states, and were not legally able to continue to provide care via telehealth unless they secured a license in those other states, ending any continuity of care to address the trauma of losing their homes, their community, and their loved ones. The Social Work Licensure Compact is a long-term solution to the issue of licensure portability. I thank you so much for considering this and ask for your support.
Thank you, ma'am. Elizabeth Pope.
Good morning. I'm Elizabeth Pope. I serve as Executive Director for the North Carolina Social Work Certification and Licensure Board. Thank you for having us and hearing this bill. I wanted to make myself available for any questions that you all may have regarding this bill. But overall, the board's mission is to protect the public and the citizens of North Carolina. And I wanted to reassure you that this licensure compact would do just that. It will help us continue with that mission. The data system that's being established will help us notify and understand who will be practicing in the state. If there are any concerns, we may restrict licensure to those individuals. And so it will help us further protect the citizens of North Carolina who are receiving those social work services that are so greatly needed. Thank you.
Thank you, ma'am. Any comments? I have a motion by Representative Cunningham for a favorable report to House Bill 231 as amended, unfavorable to the original, rolled in a new PCS with a referral to Finance. I believe that's what I heard you say, wasn't it? I thought it was. My LA has better hearing than I do, but she told me that was it. Thank you, Ms. Representative Cunningham. All in favor of the motion, aye? Aye. Any opposed? Thank you. Jack, you want me to adjourn? The meeting is adjourned. Dr. Reeder was busy.